Have you ever suddenly felt dizzy but didn't know why? Most people don't realize that dizziness, vertigo, and balance disorders affect half of the U.S. population and can strike at any time and at any age. These symptoms can be caused by a migraine, a virus, or something as traumatic as a car accident. Dizziness is one of the most misdiagnosed medical conditions, costing the healthcare system nearly $1 billion a year.
A couple years ago, I was riding a dirt bike on a long trail and heading back to home after a long day of riding. Hit a jump unexpectedly and went over the bars and landed in the pit of a third jump, and that was it. Right when I left the hospital, actually in the hospital, every time I turned to the left, that was when I really felt it. If I looked to the left, I just started getting it going a full tailspin. So I went to a neurologist in Newport Beach, and then he recommended this institute. When I came to Dr. Mango, that's when everything started making sense on what was going on.
Dr. Howard Mango, a leading doctor of audiology in Newport Beach, California, is now using one of only 12 Epley Omniax chairs in the country to quickly diagnose and treat dizziness, vertigo, and balance disorders. The secret is that the Epley chair can automatically place patients in any 360-degree position while precisely tracking their eye movements.
The treatment's fast. It was actually very quick and easy. I would say maybe within a few minutes. The treatment itself only lasted a few minutes.
According to Dr. Mango, involuntary eye movements indicate where problems exist in our balance systems, especially when it comes to the most common form of chronic dizziness called benign positional vertigo.
So our focus is definitively on the inner ears. We have 6 semicircular canals, 3 on the left, 3 on the right. And you can see what happens when we change our position. So if we're sitting like this and then we tip our head up, or we tip our head down, or we roll on the right side or roll on the left side, you can see the orientation changes those canals. So if the particles are where they belong, your brain is getting the proper signal while I'm moving to the right or moving to the left, I'm turning or I'm tipping or whatever. If the particles are in an area where they don't belong, then your brain is getting conflicting signals. So one ear is telling it one thing, one ear is telling something else, therefore we get the sensation typically of vertigo. We really have to be sure of what's going on, and that's where the technology really helps, because they may have something that truly is benign positional vertigo, or they may have something else, or they may have a combination of both. The average patient sees 4 to 5 physicians before they ever get diagnosed. So we wanted a place where people could go on their own, or where physicians could send them.
With advanced medical technology and huge strides in the field of audiology, Dr. Mango and his institute are finally providing rapid and lasting relief to patients who suffer from this dizzying medical condition.